Here we have children as young as 7 allowed to receive transgender treatment under new NHS plans. Yep, and the Tavistock Centre in the UK has recently giving transgender treatment, I think it is, to 3-year-olds or under 4s or something, and they were closed down or stopped from doing what they're doing. But obviously they're still going to be able to ply their trade in body mutilation of young children, and we now have the NHS with plans to actually give children as young as 7 transgender treatment. This is a child as age 7 who in other areas of life would not be able to, it would need parental consent, because they don't really, well, they don't know their own mind at 7, they're still learning about the world. And yet the NHS, instead of doing a ban across the board saying, sorry, you got to wait till you're 18, you decide what you want to do, that's okay, and you'll have to pay for it yourself. But for me, transgender treatment should be banned in the UK. Surgery or any form of chemical hormone treatment should be absolutely banned and should not be allowed. It should be illegal in the UK. For me, like abortion, transgender is fake gender. You're a biological male or you're a biological female. That's called, you've got a problem. You've got mental dysphoria, some kind of mental illness if you think that you are born not in the right body. You're born in the right body because that's the body you're born in. Okay? And also abortion should be banned in the UK. Why should the taxpayer be funding people who have mental dysphoria to mutilate the bodies? Why should the taxpayer be funding to murder unborn children in the womb? I don't want my tax money, the money that I pay in tax, to go towards that. Why should it? Why should the money I earn, give to the government, go towards mutilation of the body and mass murder of unborn children? Is that what you want? Is that what you think should be done? The now closed Tavistock Centre allowed infants as young as 3 to receive treatment. Now, whether it's still closed, I don't know. It's saying it's now closed, okay? But they allowed infants as young as 3 to receive treatment. Unbelievable. How can a 3-year-old make, well, it doesn't, it's logical, isn't it? It's logic. It just shouldn't be happening. Children as young as 7 years old are allowed to receive transgender treatment under plans drawn up by NHS England. Reports have claimed regional hubs in existing children's hospitals will provide the treatments after the Tavistock Centre was closed down last year. How many children were mutilated in that place? How many children are now going to sue the taxpayer? Yes, because that was run under the NHS. How many children are going to sue the taxpayer? And it's happening, folks. A young girl, 13 years old, suing because she had her breasts removed. And not only that, we've got Costa Coffee Wokey Cokey now putting cartoons on the side of their vans with a fake woman who's had her perfectly healthy breasts removed by some psychopathic surgeon. A cartoon on the side of a van going round, and children are seeing this. Adults are giving this the go-ahead. Oh, this is great. This is wonderful. I'm sorry. You know, we've got women in this country who have suffered from breast cancer, have had the breasts removed. Perfectly healthy breasts are now being promoted to be removed. You do realise this is part of an experiment, don't you? This is part of... It's like Mengel's in the concentration camps. They needed victims to experiment on. And now they've got victims and they brainwash people into volunteering up their own children now into getting sex mutilation surgery because their parents have decided, I'd like my little Freddie in a pink dress. Or I'd like my little Jane, she looks like she's a tomboy, but maybe she is a boy, even though she hasn't got a penis. Let's put her in a blue dress and send her off and get her breasts removed. You know, you're sick. Anybody doing this to the child is sick, okay? Sick, I keep saying it. Sick, sick, sick. And a government that allows this is sick, okay? And shouldn't be in government. Unbelievable. Unbelievable. Infants as young as 7 can go for a referral in an attempt to limit the use of puberty blockers. Puberty blockers, okay? That's delaying puberty. I think it's after a year or something. The first year, apparently, you can not reverse it, you just delayed it. But anything after that, you're causing real problems. Real problems for the child. Only specialist mental health professionals or paediatric services will be able to offer a referral, the Telegraph has claimed. Yes, but what worldview, what wokeness mentality have these supposed mental health professionals got? They may be able to tell you where your arm and your leg is, and your head is, and your eyes and your nose is. But what philosophy of life do they hold? Teachers and even activists were previously able to refer a child to the Tavistock Clinic. Teachers and activists. Doctors will encourage the consideration of other factors, including autism and mental health issues, which is great. At least they recognise this. But the problem is, which is insane, is they're still not getting it. And instead of just saying, no, this is insanity, they're still allowing the possibility. The NHS is under severe stress, so they tell us. Deliberate, obviously. Everybody can use it from around the world. Just come in on a boat and say you've come from a country that's heavily in war, or you're threatened for your life. I'm sorry, you've just travelled through, like, how many countries to get here? And why are the boats full of just men? Hardly any women and children, if any. Strange, isn't it? Men of fighting age. In Ukraine, the men of fighting age were told they couldn't leave and they stayed to defend their country. Why these cowards, if it's so be as they're claiming it is? Why are these cowards being allowed to come to this country? We don't want them. The cowards, if they're fleeing from a war where they could stay, they've left their women and children behind. Why are we taking them in? Doctors will encourage the consideration of other factors, including autism and mental health issues. Children will also discuss their feelings and receive therapy. The plan stress the gender dysphoria is just a phase for most young people. See, they're recognising this. At least they're recognising this in this country. Whether this is just a token gesture, we don't know, because it could be the thin end of the wedge, so they can turn around and say, yeah, but we are giving them this, we are doing this, and we are recognising. The plan stress the gender dysphoria is just a phase. Yes, it's gender dysphoria. Children are learning. Experts have warned that the discussion of gender with children could still be the first step towards a full medical transition. Dr. David Bell, a former governor at Tavistock, said labelling the problem as a gender problem can easily be the first step on a pathway to medical transition. I don't understand what he's saying here. I don't even know why they've asked him. This is the guy who was the former governor at the Tavistock Centre that gave sex and gender whatever transition to 3-year-olds. I mean, this guy should be in prison, shouldn't he? Let's face facts. The difficulty should not be designated as a gender problem. It is much more appropriate they have been as individuals who are also distressed, and this is one way in which that distress is expressed. So this guy who was in charge of the once governor at Tavistock, which is now closed apparently, children as young as 3, is now saying, it seems, basically they've suffered some stress in their life and it's a way of expressing that, which seems more logical, doesn't it? But why is he saying it now? And was he making loads of money out of this? Tavistock closed last year but has treated, there you are, listen to this folks, treated at least 9,000 children for gender dysphoria since it opened in 1989. I wonder what that treatment consisted of. Well, we don't know, do we? Because it's all mixed messages. The clinic was accused of rushing children onto puberty-blocking drugs by former patients who feel they were not challenged enough about the decision. There we go, folks. Dojo, kill the kids as well. Dojo, money, money, money. I'm a psychopath. I want to kill kids for money. I want to inject kids to stop them developing for money. I want to chop their breasts off for money. I want to chop their penises off for money. I want to try and insert a little vagina into that little child's vagina. Oh yes, I'm a pedo. I'm a pedo. I like fiddling with kiddies on their bodies like Mengels. What did Mengels do in the concentration camps? Mengels, come here, little child. I want to rip you to pieces and do all kinds of sick, heinous things to you. Yes, yes, and I'll tell your parents it's right for me to do this to them. You know, you're just sick individuals. Former patient, and I'll be labelled a flipping... What was I labelled one? I was told I was discriminating against transgenders for actually just doing videos on reality of what is happening. Yes, I'm a discriminator. I'm a sexist. I'm everything. I'm a white male. Wow, cool. I'm a phobite. Yeah. Former patient Kira Bell took Tavistock to the High Court after claiming she was not challenged enough about drugs prescribed at the age of 16. 16? Oh, dear me. I mean, who's paying for all this? Us, taxpayers. An NHS spokesperson said the NHS is transforming the way gender identity services in England are delivered following recommendations from the Independent CAS review, and this includes introducing proposed minimum age requirements for the first time. Children minimum age, dear me. Oh, 7. Woohoo! 7 instead of 3. Wow, man, that's really good, man. That's really something, man. Alongside this, the NHS is currently consulting on proposals that puberty-suppressing hormones will not be made routinely available as part of NHS care due to a lack of evidence for their use. Yep. Mind you, in Canada. In Canada. As soon as you come out, you can have sex changes by the looks of it, by the sounds of it. Oh, and by the way, if you give anyone counselling in Canada, even if you're a parent and you suggest counselling, you can have your kids taken off you. And in Canada, any counsellors who try to give anybody counselling, like is being talked about here, or talk about, you know, do you really, you know, here's what could be going on if you had any stress. If you're not allowed to do that in Canada, you lose your licence and you could go to prison. Yeah, that's Canada for you. Yeah. All you libtards out there. Now, here we have, this is in the comments, this is great, I love this. Somebody called RP53, okay, wrote, when I was 7, I identified as a pirate. Luckily, no one sent me to surgeons to have a hand replaced with a hook, a leg removed for a peg, and an eye removed for a patch. This new ideology is sheer nonsense. Whatever children say or want, there should be no transitioning until they are 18. Can decide what they want as an adult, pay for any chosen treatment themselves, and suffer the consequences of their own actions. For me, it should be banned. The surgery should be banned. Because it's just one grand experiment for those who are wanting to look for victims to experiment on, to push their agenda and narrative. Have you ever watched or read Brave New World by Aldous Huxley?